Hello and welcome to the Health for Mzansi podcast, where we bring you inspiring stories from the front lines of medicine. I'm your host, Dr and today we're stepping into the fascinating world of virology with Dr Nonhlanhla Mbenenge, a distinguished pathologist and clinical virologist whose journey from Pongola in KwaZulu-Natal to the cutting-edge laboratories of virology is nothing short of remarkable. Through her work, Dr. Mbenenge has contributed significantly to our understanding of various viruses, including the re-emergence of monkeypox and the devastating effects of the Zika virus outbreak in 2016. Here's her story. Dr. Nonhlanhla, it is such an amazing opportunity for me to be chatting to you. I must say, when I saw your career, I was like, virologist, what does the virologist do? And I was so interested to know more about your work within the healthcare space. And so I'm so interested to get to know more about the day-to-day of your work. Welcome to this podcast. Thank you so much for being here.
Thank you, Dawn, for the invitation. And I'm really honored to be part of your podcast.
Yes, it is specifically aimed at celebrating healthcare workers, practitioners within South Africa. And I'm always amazed by the type of work and the different sectors and the different areas that one can possibly step into. And so I want to just maybe start with your personal life before I get into your work in the healthcare sector. Tell us more about where you grew up, a bit about your family, a bit about your initial aspirations to pursue a career in healthcare to start. Thank you so much.
I'm born in KZN, a small location called Ngojani. That's where my mom grew up. In fact, my maternal grandparents' place. My dad is originally from Soweto, but at that point in time, he had an uncle in the same area where my mom stayed. And that's how they met, my parents. And yeah, that's where I was born. And then since I said my dad is from Soweto, around about the age of 5, I moved to stay with my paternal grandparents in Soweto. And that's where the other part of me started school in Soweto, Pimville. I did my higher primary in Diepkloof and a portion of my high school. And for my grade 9 and 10, I transferred back to my maternal grandparents in KZN, where I completed my matric, that side in Ngojani. I'm a mom of 2 boys, married to handsome Dr. Mibulai. My husband is also a doctor. Basically, in terms of the field of virology, my interest of it came when I was in medical school at the foundation. Started when I was in medical school. I remember faintly, probably Curtis, who taught me virology in my 3rd year, who used to make virology so interesting. He will talk about herpes viruses and say, if you want a boyfriend for life or if you want a girlfriend for life, just know you have one when you've got herpes. And I think that's where the foundation of being a virologist came from. Of which, as you continue with clinical years, you kind of forget about pathology and you focus more on clinical. Because when I finished medical school, as I was doing my internship, I was so interested in doing anesthesia. In fact, I thought that would be my specialty, anesthesia. But things changed when I got married and my husband was specializing in anesthesia. And I saw that this field demands a lot and I need to be in clinical work all the time. I was looking for a quiet field that will help me to be a mom and at the same time navigate the job that I love so much. And pathology came back. And at the same time, I think when 2 of my cousins died of HIV-related diseases, now I want to make a difference in terms of HIV. I even thought that I will be the one who create a vaccine for HIV. That's where I got persuaded that, okay, man, pathology is be it for me. And I registered and I was accepted and I've never looked back.
I can tell, even though we're not in the same room, you're smiling. And to think about your journey in this way, I can hear your passion for the work that you're doing and how you discovered your love for this specific sector within healthcare. I want to take a step back. So if you can just take us through a bit of timeline, in terms of where you studied at which university, what that was like. You met your husband, I think, during this time, I'm assuming, as he's also a doctor. Tell us more about that. And if you could also just explain what clinical virology actually is for those that might not know.
I did my undergrad at that time. It was called Medunsa, the Medical University of Southern Africa, which now has changed names, evolved. Now it's called Sefako Makato University in Pretoria. That's where I did my undergrad, and that's where I met my husband, who was studying there as well. I did my postgrad, my master's in virology through Wits. That's where I'm currently based at this stage. Just to highlight a bit in terms of what is virology, I always say that first by virus, tells us a virus, and ology is a study. So it's a study of viruses. Not only just we're studying about the viruses, we're looking in terms of their structure, their evolution, but our study goes beyond that. We look at the epidemiology and their effects, the virus effects in terms of public health. We look in terms of detection and management of the disease that they cause, the impact they have in terms of the hosts. And then we also navigate it and collaborate closely with the clinical team, because we do not see patients most of the time. It's seen by doctors. Then we advise them in terms of how to manage these diseases. And also we part in terms of training of the medical students in terms of viruses, and also involves research. That's our day-to-day, right, in terms of virology.
So you're currently based or working for the National Health Laboratory Services, and obviously your work also involves teaching. It involves, offering clinical advice. What can you tell us about day-to-day work and your experience in your role as a senior pathologist and virologist at the Charlotte Maxeke Johannesburg Academic Hospital? Thank you so much.
Our day-to-day work involves in terms of diagnostics. We are involved in terms of detecting what's wrong with our patient. And we work close with the clinicians or other healthcare workers from primary health to high-level care. We involve in terms of diagnostics service in terms of detecting what's wrong with the patient. And we liaise and work closely with clinicians, including the primary health care workers, in terms of detecting what's wrong with the patient and advising them in terms of what sample to send, and in terms of if there's the condition that they're not sure of, and case of meningitis, and they're not sure which possible causes could be, we advise in terms of that, in terms of treatment and management of this disease. So now and then we go do the ward round. We involve mostly with the infectious disease specialists in seeing patient. You're just highlighting the case that we had today. We called in today for a case. It was a case of a patient with an enterovirus that was detected in their CSF. That's where we go there and advise in terms of, we look at the patient. Is it something that we worry about? Which of the enteroviruses, because enteroviruses are many, that group, that family, quite a number of viruses there. So we guide the clinicians in terms of what to do next and how to manage the patient. And at the same time, we do teaching, different levels of academics in our setting. We teach the undergraduates, which are different fields. When you come to the health science faculty, where there's medical students, we've got nurses and allied students, allied health students, which includes pharmacology students, which include your dentistry students as well. And at the same time, we teach the postgrads, which could be the honors from virology honors students, to other specialties that have a curriculum of infectious disease in them. for example, microbiology honors as well, and the other clinical faculties that require infectious disease in terms of honors, masters and PhD level. So our variety of students is big, postgrad and undergrad. And at the same time, we're also involved in terms of research. It's a requirement for a clinician to know what's happening in the field and do a bit of research in terms of give a perspective and contribute in terms of public knowledge. I said a mouthful there.
That was a mouthful, but I think it also just paints a very clear picture of the scope of your work, and that you have so many hats that you're filling and so many areas that you're working in, which I admire so much. I think it's absolutely amazing to think about how dynamic the work that you do is and how you contribute to the health sector in so many different ways. So very much admiration and inspiration I'm sure that you're giving to other people interested in this field specifically. Now, are there any, significant experiences or findings from your research that have contributed to the field of virology that you're very proud of?
It's one of those things that I think I missed from your question, the rewards that you're highlighting, that you see your work going out in terms of your publications, in terms of doing this kind of work, because it requires one to be involved in research. I am most interested in vaccine-preventable diseases. I did a master's with Switzerland, University of Lausanne in Switzerland. So I did a master's in vaccinology. I just did, which shows my interest in that area. I was looking in terms of hepatitis and the gaps that we have in terms of the immunity for hepatitis B protection. Remember, hepatitis B vaccine is available and has been part of our expanded program of immunization since 1995. But one was looking, where are we in terms of reaching a state where we can say we are winning against hepatitis B? My findings was that we are still on the high endemicities at this stage, regardless that we've been having the vaccine available for this number of years. So it's one of those things that was my finding in terms of research. In fact, in my field, there's lots of rewards. Besides that, when a patient is sick and you're able to bring to their knowledge what is affecting them, it's just a reward on its own. And I always say there's never a dull place when viruses are involved. In fact, one of my slogans, which I've put on our board outside here, is "Virus is wrong." Not in the element of how people look at viruses, but in terms of their interest in how they evolve and how they change. And that's an element that I think is common with humans and viruses, is that the ability to adapt in the environment they find themselves. There are many other rewards that comes with the field, opportunities to grow as a clinical scientist. Many clinicians or doctors, they kind of evolve in the day-to-day to seeing patients. And our field is not only that element. Of course, we are in charge of both fields, the diagnostics, the laboratory medicine, and the clinical field. So it's one field, that pathology, that's able to bind the two or kind of give her the leverage of the two. But besides that, we contribute to the knowledge gap that is there in terms of these diseases. And some of us find ourselves impacting not only the medical field, also in the community, because I do lots of community teaching as well in terms of coming to these diseases. And pathology gives you a balance of life. This is the only field that you are able to go home and be able to relax and have family time when you're not on call. So there is that ability to balance work and life in general.
You seem to be very clear-headed and you sound extremely calm talking about the work, the research that you're doing, but more so that it gives you more flexibility in balancing or dealing with the demands of your work, but also your personal life and all of that. So this is usually advice that I ask towards the end of the conversation, but you can share more tips about how you actually do it as we're wrapping up. You know, with the ever-evolving landscape of viral diseases, what significant changes have you witnessed in the field of virology throughout your career? You did mention the ever-changing aspect of it. So if you could just share a bit of detail on that, please.
I always say virology is one field, a specialty that is ever-evolving. Definitely, there are various significant changes that one will witness when they're in this field. Currently, we're seeing reemergence of viruses, and as they reemerge, we come with change in traits. For example, we currently dealing with Mpox outbreak, and Mpox was one of those diseases that's confined. It was detected in Africa, in Uganda, some years back, and confined in that geographical area. And suddenly, we're seeing its transmission has changed. Its mode of transmission, it's the same, but its ease of transmission here has come up. One needs to look, is it the pattern? You have humans change patterns. What in the environment is making the change in terms of that? Was one of those viruses where one looks at is the skin lesions and was not associated with significant mortality. And suddenly now we're seeing a change in its mortality stage, especially to those that have comorbid diseases and immune suppression. The other example was Zika, which we had a Zika out 2016. Zika was also one of those unknowns, only those that in virology will know about the disease. And we saw in 2016 it became a serious outbreak, and it came with a congenital manifestation in terms of a pregnant woman, where pregnant women suddenly had microcephalic babies. So those are the significant changes that we're seeing in terms of re-emerging viruses. And at the same time, we're seeing emergence of new viruses. And we always say in virology, we do expect in certain years a pandemic will come, because virology is linked to our immunology. Why is it linked? Is because the immune system is one powerful system that is the only one that is able to clear the virus completely from the person who's infected. Viruses, remember, they grow, they replicate themselves within a cell. So it's going to clean them out or tear the infection. We need to kill the infected cells. And medication cannot do that. No antibiotics can do that. No antivirals can do that. And it's not good to destroy your own cell effectively with drugs that are currently made. So the immune system is the only mechanism that is able to clear virus without affecting our bodies, the other normal cells in our bodies. So we're seeing this emergence of new viruses that we didn't expect. 2020, we had COVID caused by the SARS-CoV-2. Many people do not understand that we had SARS-CoV-1 in 2003, which kind of disappeared. And now the virus is not a re-emergence because it's a totally novel virus. So this is an emergence of a novel virus, SARS-CoV-2. So there is just interesting emerging and re-emerging disease that comes about that you're witnessing. And we at this stage speculating what else is coming that will come and try to bite us and that we need to be aware of.
And this was part of my questioning, the recent global health crisis where the entire world was affected by the COVID-19 pandemic. What do you believe are the most pressing challenges in virology research and public health preparedness when it comes to everything that you've just mentioned? And I think that public health preparedness is a very important aspect, because even in my conversation with you now, I'm gaining a better understanding of the work that you do and also how it works generally when it comes to viral diseases. But what do you think needs to be done more of? How else can we share more of this information? I'm so happy to be able to talk to you and pick your brain a little bit today. But where are you moving towards in the future? Thanks.
I'm not sure whether we are there in terms of preparedness, but if I be put to plan ahead, there are lots of treaties and talks currently that are going on. I know WHO has released a document in terms of pandemic preparedness treaty, and which is trying for different countries to buy into that. If I have to give my input about the challenges that we meet in those areas, is we need to strengthen our logistics and supply. Basically, from recruiting and training of healthcare workers, I'll start there. I think we are not producing enough healthcare workers for the disease that we are seeing. At the same time, even specialization, we do not have much opportunities in terms of people to specialize, in terms of being experts in the field of virology, as is the field that we're talking about currently. That emanates from costs in terms of it requires lots of money in terms of trainings as experts in the field. moving further from that, challenges would be how quickly one can produce medicines and vaccines. And virology is one field that is lagging behind in terms of developing antivirals and vaccines. We don't have many antivirals, to be honest, at this stage. Yes, for HIV, lots of money went into terms of developing the HIV antivirals, and still lots is being pumped there, and which is necessary, of course, looking at the epidemic that we are having for HIV. When it comes to vaccine, I get passionate about, because I always say, let's not look at the future. Let's start first by addressing the vaccine equity. How do we come about that one? Is we currently have several vaccines that are available in the first world country, but are not made available in the third world country. We saw with COVID, we were the last to receive the vaccine in terms of SARS-CoV-2 vaccines, while the first world country kind of collated for themselves everything. We can address those vaccine equity, or even just not only vaccines, everything must be equitable. Sharing medication, sharing of the expertise, sharing of our equipments that are necessary for the next pandemic. When it comes, we would be prepared, because there are talks in terms of that. But at this stage, that's what it might take. The challenge is making everything equitable. Not only should not be considering the first world, but consider everybody. Whatever is available, let it be shared equally amongst ourselves. And continuous research, continuous surveillance. What we're seeing is diseases that are taken for granted, and then next thing they are spreading and killing our people.
I can hear your passion for this aspect of the work and kind of bridging these gaps for it to be more equal within the healthcare system globally for all. I think those disparities was made very clear during the COVID-19 pandemic. And I'm so happy that we've now somewhat moved past it, but I think you're right in the sense that we now have a better understanding of what needs to happen moving forward. I think we still have a long way to go, but it's people like yourself that will continue to advocate and push for this. That is, essential for this future that we see for ourselves on the African continent, but everywhere else as well. And especially here, I must say. Can I also just ask you on a more personal level, some of your goals and aspirations for the future, where you see yourself in the next 5 to 10 years, but more about your family? You have 2 beautiful sons. What would you like to share with them as part of your goals and aspirations? If they get to be in the medical space, it's going to be a whole family of doctors. Really admire that. But yeah, if you could just share a bit more on your personal life in that way, ma'am. Thanks.
Like the little one now, who's still in school, to keep his science subject. But my eldest just finished, he's doing his second year in university currently. Made sure when he was in high school that we will not bother him about medicine. He took business subjects and accounting so that we do not trouble him. When I asked him, so why are you leaving science? You are good at science. He says, I don't want you guys to tell me about being a doctor because I'm not interested. Always studying, you're always working. So he took the business side. We don't force them. It's their life, so they must choose what they love to do and be happy, as me and his dad are happy in the field that we have chosen. The little one is still in school. I don't know what he will want to be, but he loves sports. He's very sporty. He's good in cricket. He's good in rugby. So though my husband will say, yeah, it'd be nice to have another doctor in the house, but yeah, we will see with him as we grows up. What the future holds for me is I've been a virologist for quite a number of years now, but I'm in a space where I am more focused now on research, trying to elevate that arm of my career, especially in the vaccine preventable diseases. I truly believe that vaccines are the key in terms of managing infectious disease. We have seen that with smallpox, dreaded disease. And through vaccine, smallpox is eradicated. Hopefully with the second virus to be eradicated, polio. We in Africa have eliminated polio, but it's still circulating in 2 countries currently, Afghanistan and Pakistan. And hopefully, if those two countries can eliminate it, then we can have the polio eradicated as well. Also a dreadful disease where one gets paralyzed and subsequent to that, others do not even come out of it, because when you get the bulbar polio combination or the bulbar polio alone, where it affects your breathing, so you cannot breathe, you need a ventilator to be able to sustain yourself, person who's infected. It's also through the vaccine that we're seeing such drop in cases. So I think that's the arm that I'll want to see myself venturing into and continue to do training in terms of that element. Education is the key for everything as well, giving public education in terms of these viral diseases, their epidemiology and their management.
Thank you so much for sharing your story with us here on Health from Mzansi. Dr. Mbenenge's journey from the streets of Soweto to the forefront of virology is a testament to the power of determination, the impact of mentorship, and the importance of finding a balance in life. Her story is an inspiration to all of us, showing that with the right support and a deep sense of purpose, we can make a significant impact on the world around us. Until next time, greetings from me, Donumdu, our technical producer Megan van der Vent, and the rest of the # Team Health for Mzansi. Stay inspired.